One of the barriers to effective smoking cessation pharmacotherapy is concern over the experience of adverse events. And there are misperceptions which exist about the frequency and severity of adverse events related to smoking cessation medications, and I believe these misperceptions are held both by patients and many clinicians. We measured the incidence, the time to onset, and the duration of the frequently reported AEs. We did identify 8 frequently reported AEs that differed significantly in active treatment compared with placebo. Nausea in those who received varenicline, insomnia in those receiving bupropion, and abnormal dreams in those receiving NRT patch.
This video content is copyrighted by Mayo Foundation for Medical Education and Research.